So we continue our talks about the CBT, cognitive behavioral therapy, and today we're gonna talk about basics for anyone, because there is new faces that we have in the groups, and they don't have huge background about the cognitive behavioral therapy. So I thought let's focus a little bit on this session on the basic foundations for the CBT. So in this model, this is one of the most effective treatment that all counselors, psychologists, psychiatrists, doctors use it for therapy. It depends mainly, or the main idea behind it is our thoughts leads to our feeling, leads to our behavior. And then our behavior will reinforce our thoughts again, and then the cycle continue. So a quick example for that is if you have negative thoughts about yourself, like I'm a failure, I'm a loser, nobody likes me, I'm unlovable, unlikable, this is going to cause depressive feelings and the feelings of low self-esteem. And of course, these feelings and these thoughts are going to change your behavior, and they're going to affect this behavior, most probably going to be negative behavior that's going to affect your work and relationship and your mental health. So in this model of treatment, we try to change the thoughts or the beliefs, hoping that feeling changes, then behaviors will change too. Here's another example for a guy who have depression. So because of depression, they have lots of negative, irrational thoughts that there is no point when they wake up in the morning. There is no point. I will only mess up again. I am a loser. I'm a failure. And this cause feeling of depression and the tiredness. And when you struggle with these feelings, it's going to end up with staying in bed and pulling covers over your head and not going to work. So you see the cycle, how the thoughts end up with feeling and behavior. Our goal for the CBT, main goal, is to change the thoughts from negative or irrational to mainly rational. I'm not saying always change it from negative to positive. No, we wanna change it from irrational to rational, because we wanna see the reality. Too much positivity is also irrational. Okay, so too much negativity is irrational. So we wanna see life in balance. Okay, so again, if you have only positive thinking, I think this is irrational. We wanna, yes, sometimes focus on positive, but we don't wanna ignore the reality of the negative in our lives. Okay, how we change the thoughts or the beliefs that we have. One of the main concepts in CBT is something called the core beliefs, which is the central ideas that everyone have about themselves and others and the world in general. Again, in CBT, when we say core beliefs, this is mean central idea you have about yourself or others. Okay. They found for depression and anxiety and addiction and the PTSD, people usually have some negative core beliefs. Okay, and this is the whole list of the core beliefs. I know some of you are familiar with these beliefs, and it sounds like these beliefs can cause problems. Okay, I'm gonna go through all of them very quick. So for those who don't know what are these beliefs is. So believing is, some people, especially with depression, they have core beliefs that I'm a failure or I'm a loser. Okay, I'm not good enough. If you have this belief, this gonna cause something else called the automatic thoughts, which it will be thousands of thoughts every day. You know, because you're gonna see this is the lens through which you're gonna see your actions and your work and your relationship and your financial situation and everything. So if the main core belief is failure, this is going to change the way you look at yourself and others. Okay. Another people will have this belief unlovable or unlikable, that nobody likes me, nobody cares about me. Another one is helplessness or helpless, which believes that I can't cope with life, I can't manage anything in my life, I can't help myself, and nobody can help me. Worthless. Worthless means like I have no value, or I am unworthy, or I'm a defective. This is common for people who have shame, lots of shame. Abandonment means that anyone significant other in my life will leave me at some point. So abandonment, the belief of abandonment means that at certain point, people around me will leave me. Whatever it is, a family member, a partner, kids, co-worker, whoever is around you. Mistrust means you can't trust. This world is unsafe and I can't trust anyone. And when it's too much, it becomes paranoid ideation and the paranoid delusions. Vulnerability means the world is unsafe, and you feel in general unsafe in regards to relationship, medically and physically, financially. Emotional inhibition, this means like I cannot express my feeling, and it is better to inhibit my feeling or suppress them or repress them. Okay. Because nobody will respect them, because it is too dangerous to express my feeling to others. Emotional deprivations mean even if I express my feeling, nobody will fulfill my emotional needs. And I will not get my emotional needs met. Entitlement is the opposite side. Like, no, you feel special, you feel more deserving than others. Okay, we don't want to feel losers, failures, and lower than others, but also we don't want to be narcissist, feel more deserving than others. Punishment means like I deserve punishment. And sometimes this idea becomes sexualized in sadism and masochism. Insufficient self-control, which you believe I have to have it now. It is common with addiction, that I can't control my craving. I don't have sufficient self-control. Okay, so again, these are the main core belief, and these are the basic or one of the main principles in CBT. So, and we're gonna use them all the time when we treat obsessive compulsive disorder with CBT, when we treat depression, when we treat addiction, when you try to use CBT to treatment different psychiatric problem, you need to be aware all the time about these core beliefs. Okay. By the way, these core beliefs, when people have them, they feel true. Okay, but if it feels true, it doesn't mean usually it is true. So this is still your belief, but it is not facts. So it is better, it is good to label this belief like a belief that you are a failure or hopeless or helpless or unlovable or unlikable. It is good to label them as belief because they are not facts. Okay. Skip this one. Okay, the second part of the session today, we're going to talk about something called the cognitive distortions. Cognitive means intellectual, right? Distortion means irrational. So cognitive distortion is a pattern of thinking, which is irrational. And still, it is common in most psychiatric problems. People struggling with anxiety, depression, or whatever, you're going to see them using this irrational pattern of thinking. Okay, I'm going to go through them very quick as well. For example, one of them is discounting the positive. This means, you can't see the positive in life. You see only the negative. You see only the negative in relationships. You see only the negative in your kids. You see only the negative in your work. You see only the negative in your personality traits. You reject anything positive and see only negative. Of course, this is going to cause problems. Okay. Overgeneralization. For example, all men are mean or all women are unfaithful. So let's say you have bad experience with men or bad experience with women, then you form this idea that all women are unfaithful or all men are mean and rude. Of course, this is going to cause problem for future relationships. Rationalization, this is common with addiction. You create excuses for negative behavior. Oh, I drink because of my wife. I drink because of my boss. I drink because of my financial situation. I drink. So you find an excuse for a negative behavior. Jumping to conclusion. So you jump to a conclusion without a fact or without a support. You have to support this conclusion. This also can cause problems, very common. Mind reading. Mind reading, you assume you know what other people are thinking about, especially thinking about you. You know, so you think, you know, oh, I know I can read their mind. I know what they think about. So these all are examples for irrational way of thinking that can cause problem. Another one is compare and despair, you know, which is common in social media. You compare your negative side or negative aspect with other people positive aspect. So people post on social media the positive side of their experience or their life. Then you automatically use the compare and despair. So you compare, you don't compare your positive experience with their positive, you compare your negative with positive, and it causes problem. Catastrophizing mean you expect the worst case scenario and you start thinking about it. For example, you think, you know, I'm going to lose my job and then I'll become homeless. Then I'll stay in homeless shelter. Then I'll use drugs. Then the shelter will kick me out. Then I will be on the streets. Then I don't have food. Then I'm going to die. So you catastrophize the experience you are going through. And of course, there is like biological benefits, like survival benefits for doing this, because you always scan, especially thousands of years ago, you always scan the environment to identify any possible or potential risk, because attack from a snake or from a lion or whatever animal could cause you death. So we try to catastrophize. Anything you hear, you think the worst. Anything you see, you think, anything you feel, you expect or you predict the worst. This is not the case now. I think we live in more like a safer environment now. Black and white thinking, or we call it all or none, which you believe, you know, life is just black or white. Okay, my husband is the best man in the world. Then he do one mistake. He is the worst husband in life or in the world. You know, so you see, you don't see the gray area of everything. You see only black and white. Dr. Hanif is the best doctor in the clinic. Dr. Atala is the worst doctor in the clinic. When you classify things all the time like that, it's going to cause you problems, because you will not be able to see reality. Because again, few things in life that are totally white, few things in life are totally black. Most of things are within the gray area. Also using should and must all the time. Sometimes we need to use it, should and must, when we talk, but if it is all the time, it set up unrealistic expectation. Magnification, which you exaggerate things around you, the importance of things. So a minor problem like this, you see it big as that. Or minor achievement, you also see it like that. So you exaggerate everything. Personalize, this is very common. Your kid fail in math or fail in biology or whatever, then you feel, oh, he's failing or he's not good at math because I'm not good mom. or because I don't provide enough care for them. So you personalize everything negative happen around you. You think in some way you are responsible for it. Labeling means you give a label. It's similar to the core belief. So you give again, label, it doesn't mean that a core belief, it is a way of thinking. You give labels to stuff and then you generalize it. Oh, he is an idiot. That's it. So every time you meet with him, he is an idiot. So if you give your partner this label, he is an idiot. So you'll never see something positive in them. I am a loser. This is my label. If this is my label, okay, no matter what compliment I'm going to receive, I'm not going to see it because I'm a loser. Another way of negative or rational thinking is always being right. When you believe that you are right all the time, and you live all your life just to prove that you are right. Okay. I know when I'm going through the core beliefs and the cognitive distortion, some of them click with you. Some of them you feel, oh, I do it all the time. Catastrophize all the time. I compare myself to others all the time. I give labels to people all the time. I personalize all the time. So I'm sure there are some of these you can relate to. Okay. So the activity today is you tell me what are your common negative core belief and the cognitive distortion. So I'm going to put the list here in the chat. So you have the list. Tell me which core belief you struggle with. Again, what are the core beliefs? I memorize them because I see them every day with my patient. So what are the negative core belief? Failure. I am a failure. I am a loser. I am helplessness, hopelessness, vulnerability, abandonment. Everyone will leave me. Mistrust. I can't trust anyone. Emotional inhibition and emotional deprivation. I can't express my feeling. Nobody will fulfill or satisfy me emotionally. Forget about it. Lack of self-control. I can't control my craving. I can't control anything in my life. So these are the most common negative core belief. How about cognitive distortion? Most common that I see is we all do it at certain point. To some degree, you do it. Discounting the positive. You don't see something negative happen. You don't see everything. You don't see that you have a job. You don't see that you have a place to live in. You see that you have food. You don't see that you have family. You don't see you have a degree. You don't see anything. You just become focused and magnify the negative part, which is discounting the positive. Black and white thinking. See it every day. A patient come tell me, oh, this was the best experience, or this was the best trip in my life, or this was, sometimes I do it too. So when you think this way, the best, the worst, ever, never, these words give you impression that they use black and white thinking. What else? Catastrophizing. See it all the time. You do a test and then you see few numbers high. Even it happened with me. Like I had a rare condition for high blood pressure. Like I have high blood pressure, but it's caused by rare problems, like real endocrine hormonal problem. Not everyone will have high blood pressure, will have my problem. But since I have this, and now I expect all the time that no matter every time I have headache, oh, this is cancer. Heart racing, oh, it is heart attack, because I generalize or I catastrophize every experience based on one negative experience. What else? So black and white thinking, discounting the positive, catastrophization, mind reading, prediction, like you predict the future, you think you know what's going to happen in the future, and so on. These are the most common, and every time, like the ones that I highlighted now, is the ones that remind me of with my patient. I see it all the day, every day. So I want you to choose the ones that you feel it causes you problem. and tell me what is the impact of this core belief or negative cognitive distortions that you have. You tell me how it affects your life. So you have the feeling that I am a failure. Yeah, tell me how it affects you. Okay, maybe it affects your relationship. Maybe it affects your work. Maybe cause problem with self-esteem. Maybe psychiatric problems. So tell me how it, what is the impact of the core belief and the cognitive distortion on your life. And the last part of the question is, the next time you notice yourself using this belief, what you're gonna do? Okay, so you have a belief that you are a failure, and it had negative impact on your work. And the next time you use this belief, or you notice that you have this belief or cognitive distortion, I will, and tell me what you're gonna do. Maybe you're gonna journal about it. Maybe you're gonna read a book about low self-esteem. Maybe you're gonna listen to a talk about self-esteem and the core belief of failure. Maybe you're gonna distract yourself. Maybe you're gonna replace it with more rational and positive thought. So you tell me. Of course, down the road with the CBT, we're gonna learn the techniques how to replace the irrational beliefs with more rational. But for today, just let me know, out of imagination, like, what would you do to fix this problem? Okay, I'll give you a few minutes, and I'm gonna share here the list of core beliefs and the list of cognitive distortion. Thank you.